Hey guys, it's Nurse 18. Let's talk a little bit about high flow nasal cannula. So high flow nasal cannula has a ton of benefits. Number one, it provides heat, it provides humidity, and the number one thing it does is provide flow. So how does it work? It just provides a constant flow of air into the patient's airway, up to 60 liters per minute, and that reduces the workload of the patient breathing. We use this a lot in patients that are hypoxic or have an increased work of breathing, and it's just helping them do what they're already doing on their own. If I wasn't standing here on this escalator, I would just be tumbling in a pile at the bottom of the escalator, but this is providing upward flow. Now, some people might tell you that high flow nasal cannula also offers PEEP. Well, kind of, but not really. So if I'm walking up the escalator, of course, I'm gonna be going up much faster than if I was walking up a flight of stairs. But on this escalator, yeah, I can take a deep breath up, but I need to exhale. And see, I'm coming down the stairs, but there's still upward flow. And so high flow nasal cannula is going to, let's see if I can reach the bottom. High flow nasal cannula. So while I'm fighting for my life here, getting back down the escalator while it's going up, the point I'm trying to make is that high flow nasal cannula actually expands or increases your end expiratory volumes. And that's how it kind of provides a surrogate for PEEP. So you might be thinking for yourself, okay, well, how is this different from CPAP? Well, CPAP is more like an elevator where it has to interact with the patient. We got to push a button to call the escalator, and it's waiting on my interaction to tell it what floor to go to. So CPAP requires interaction with the lungs. It's delivering flow like a high flow nasal cannula, but it's based on a pressure that it assesses what it's feeling from the lungs. So let's get back to high flow nasal cannula. It provides heat and humidity, and both of those things help to reduce the patient's workload of breathing and help to reduce complications of mechanical ventilation because it encourages that ciliary function. And those are the tiny little hairs that move junk and crap out of the airway so that our patients can breathe without getting mucus plugs or infection. Now, the other thing that high flow nasal cannula is great for is dead space washout. Did you know that a third of our tidal volume, a third of the amount of air we move in and out of the lungs per minute is just dead space air. And we can replace that with high flow oxygen. We can go up to 100% FiO2 on this, and then it becomes usable air that we can actually use for gas exchange. So there you have it, a little bit of information on high flow nasal cannula, and please don't try to go down the up escalator.